mid-face model, or what we call Bookface. And this is a unique model to help explain to your patients sinus anatomy and also the different surgical procedures. So it's really unique and novel about this model is that you can flap it open like a book, and it has got 4 different segments. It's all attached with a magnet, so it can close quite easily. At the back you've got a little magnetized box that we call our tumor box, where you can use this putty to place in various different parts of the anatomy to simulate a tumor. So if we open Bookface, it's really easy to explain to a patient what kind of surgery you can do, or to a student what kind of surgery you're going to do. So if you look at the middle part, this is the nasal septum. And in this model, our septum is slightly deviated towards the right side to actually help understand what a septoplasty or septal correction surgery would involve. So you can see it contains bone and cartilage in the front part. And then on both sides of the nasal septum, you have nasal mucosa. So septum consists out of 3 layers: mucosa, bone or cartilage, and then mucosa. And when we do the septoplasty, we can either do a little incision on the front, or we can do a little incision a little bit further back. And the camera then goes between the mucosa and this nasal bone, so basically in that space. And that's why we can, or how we can then easily correct septal deformity. So patients always ask, are you going to do the right side and the left side? But it's easy to understand. This is in the middle, so it doesn't matter which side you make your cut. If you correct the septum, both sides of the nasal cavity is equally operated on. Then what is really nice to explain with this model are your nasal turbinates. And you have got 3 turbinates on each side of your nose. 3 on the right, 3 on the left, what we call an inferior turbinate, a middle turbinate, and a superior turbinate. And sometimes there can also be a supreme turbinate. And these turbinates are really important. They're pink in the model to simulate normal nasal, healthy normal nasal mucosa, which shrinks during the day, and it also congests during the day depending on how the blood fills up in these structures. So if you use an oxymetazoline spray, it shrinks this turbinate, and that's why people can breathe better. This structure we sometimes make a little bit smaller with something we call a turbinoplasty, and we don't do a turbinectomy, which would mean taking the whole structure away, because then your nose will be too open and it will cause drying and crusting. The middle turbinate is a very important landmark to the nose and to the sinuses, and it guides us to all the different sinuses. In this side, on the right side, we can see the frontal sinus. And now the sinuses are air-filled spaces, and if I turn this model around, you can see you've got sinuses above your eyes. In this specimen, you've got a big sinus on the left and a very small one on the right, and they're air-filled spaces. If we open this towards the left side, we can also see underneath your eye, you've got a sinus, we call it the maxillary sinus. It's a very big sinus that can hold almost 10 millimeters of fluid. Then you have got a special sinuses between your eyes, and this is called the ethmoid sinuses. This is the area behind this middle turbinate and kind of behind the superior turbinate. In this little space, and that's where, if people have nasal polyps, that's where polyps will grow from those sinuses. So in order for us to do surgery, we have to slide into this little groove with our camera and make space to get to those tiny sinuses to get there. And then we have a very big sinus in the middle of our head. If you had to draw a line between your ears and through the center of your head, where those 2 lines meet, will be your sphenoid sinus. And this is a very important sinus for us to access when we do certain surgeries and brain surgeries like pituitary surgery. We need to go through the sinus and through the back wall to get to the pituitary fossa. So if I take this model and turn it around, this would be our pituitary fossa. So we go through that sinus, and as we exit the back wall, we will then find our way to the pituitary fossa to remove that brain tumor. So the nasal cavity is really an amazing structure, not to just get to the nose and to the sinuses, but also to the middle part of the brain and of the skull. Our problem has been to get to the outer 2/3 of the head, and that's when neurosurgeons have to do a craniotomy, where they would essentially, if we look at this model, they would make a big cut on the outside of your head to get access to that lateral third or the outer third of the skull. But now, since Chris Moe developed the techniques of transorbital surgery back in 2010, we don't need to use the nose anymore to get to certain parts of the brain. We can now use the orbit or the eye.